Time for another visit here at Performance Medicine in Johnson City, joined by Dr. Tom Rogers. And Doctor, today we're talking about IV therapies. This is something that you and I have not talked about. Give us a little overview of what IV therapy is all about.
Well, for years, as being the team doctor for our high school football team, I'm always starting IVs on the players because they get dehydrated and all. And then I went to Chattanooga where they were doing more IV hydration therapy. I learned a lot about it, and I went to various centers for IV hydration and found that not only are most of us dehydrated, but you can treat a lot of people with IV therapy that you ordinarily couldn't treat with an oral medication, even a vitamin.
And most people come and they get a supplement and they take it and they think they're doing themselves some good, and they're doing themselves a little bit of good, but even more good can be had with an IV therapy session.
Exactly. I'm a big promoter of vitamins, and I certainly take a lot myself, but really when you take a vitamin, only about 20 to 30% of that vitamin's really working in your body because it has to go through your GI tract.
Right.
So most of it doesn't get absorbed. So there's people out there that really need these medications or vitamins to go in an IV, because when you get it through an IV, 100% of it is going into your cells. So I see a lot, not only just hydration, but we've learned that you can use various cocktails, like we use something called a Myers cocktail that has vitamin C in it, has the B vitamins, and we use glutathione sometimes with it. Sometimes we just give higher doses of vitamin C.
Right.
It's amazing how much energy you get from that. So in certain conditions, say like fibromyalgia or chronic fatigue, or people that just don't feel well, or even people that just, they're kind of hungover, they're sick, or they have the flu.
Right.
You can hydrate them with intravenous fluids in a very short period of time, and it's just amazing the effects you get from it.
And you go into an emergency room situation or you go into a hospital situation, they give you IV fluids there, but you're going to be able to do that on a lower cost basis here.
Right. If you go into the emergency room and get an IV, that's the cost alone of that's about $1,500.
Wow, incredible.
We do that for a fraction of the cost, and very conveniently too. So.
And you mentioned some of the situations where if you're sitting there and you're going, well, is this for me? There's some questions the person's got to ask before they come to see you, isn't there?
Exactly. There's various things we can do for you. I always need to consult with a medical doctor, which is me, beforehand, and I can determine whether or not this is going to help you or not. I'm certainly not going to do anything that's going to hurt you, but we're trying to bring it to a little different level. There's too many people walking around tired and sick, and when they really don't have to.
And I know with the flu especially, you feel so run down and so ragged, you may be feeling better, but an IV therapy may get you back up to where you need to be.
My daughter had the flu last week, and I hydrated her, and she just turned around in about an hour with the flu.
All right. Great information. One-stop shopping here, because medical doctor right here on site to help you with your IV therapy needs here at Performance Medicine. And get more information at performancemedicine.net.
The preceding portion of Daytime was sponsored by